Congressman Johnson. Thank you, Congresswoman Ileana, for your leadership and for giving me the chance to really work with you on this entire strategy. And I'm sorry I have to leave. We have a mark of this program for a few minutes.
Well, thank you very much, and Barbara Lee has been a leader in this from the very first, and I'm so proud to be joined with my fellow congressman from the South, Mr. Johnson, who's a good friend as well. So you've got a lot of wonderful fighters on this cause, and I'm very proud to co-sponsor this important HIV/AIDS seminar briefing with all of you. We have made substantial progress in fighting HIV/AIDS. I know that the numbers are staggering, but when you look at what it used to be, that kind of diagnosis was a death sentence once upon a time. And individuals and communities are now more educated about the realities of HIV/AIDS, how it spreads, how to protect oneself from infection. But as Barbara said, our work is certainly not done. The growing HIV/AIDS crisis in the southern United States is proof in those alarming statistics that she read that there is still so much work to do. According to the Centers for Disease Control, half of all newly reported HIV infections are in the South. 7 southern states account for 7 of the top 10 states in the country with the highest AIDS death rates. Factors such as limited access to HIV care providers could be one of the problems. Poverty levels, social stigma that has led to this greater impact of HIV/AIDS in the South. So as a member of Congress from South Florida, I have seen the impact of HIV that it is having on our communities, the toll that it has taken on all of us. Over almost 100,000 Floridians are living with HIV/AIDS. Over 24,000 live in my home area of Miami-Dade County. But I've also seen the great work of activists and organizations and experts that have led to so many Floridians getting the test and getting the treatment that they need. And one of those individuals is Valerie, right there, is here today, and her work as executive director of the Basics Northwest Florida has helped this volunteer-governed, community-based organization assist those living with HIV/AIDS and their loved ones, because it, as you know, doesn't just impact a person, it impacts the family and everyone around that individual. And today's roundtable, I'm sure, is going to shine light on this growing crisis in our area of the South. And I thank all of you, the medical experts, the activists, the corporate representatives, the pharmaceutical companies, the congressional staff here today. That's the first step that we need to take to look forward to a public-private partnership that can prove effective in curbing and indeed stopping the number of HIV/AIDS infections in the South. This is preventable. We're able to stop it. And it's thanks to activists like all of you here in this room that as startling and as stark as those statistics are, there is a ray of hope. And that rainbow is for all to see. Thanks to all of you. Muchas gracias.